abis canadensis. It comes under pinus group. So coniferous is the family. So first thing what I will do, that what are the other drugs of coniferous we should know. Like thuja, we know thuja is an antipsychotic remedy. Then sabina, we have sabina, and we have terebinth. Another one is our abis canine, abis nigra. Both are comes under coniferous and conium. So these are the drug we should remember about coniferous family. Okay, or okay, understand? So now we will go with Medica first drug, that is borieck. First drug we will discuss. So now we will discuss about the guiding feature, where mainly it is prepared from bark or bud it is prepared. Now the mainly the mucous membrane are affected by abis. So gastric symptom is the chief most important symptom where we can give along with uterine complaint, omen, and fever. These are the case where we can use abis can. Okay, so mucous membrane are affected, most marked, and a lateral condition of stomach we can produce. The peculiar thing is the crabby and chilly sensation that is very characteristic. Means there is a canine hunger. There is a hunger, always want to be eat. So that's thing. Defective, but that's occurred due to the defective nutrition. Absorption and assimilation is defect. So another is respiration and heart action is also labored. Skin cold and clammy because of a chilly sensation. Hands are cold, fainting occur. Another is right side lung and liver is affected. Now head feels light-headed, tipsy and irritable. What about stomach? So cannabis, you remember cannabis as cannabis, there is abis canadensis. Abis canadensis, that having can having canine hunger. Okay, can having canine hunger. That is the important remark. You should always remember that canine hunger is the important thing we should remember for abis. Along with the torpid liver. What is torpid liver? Means lethargic liver. Lethargic means liver action is not work properly. Important line that what you should remember about that: eat the things that is coarse food, pickles, meat, craving. These are the things having. So coarse food means raw food. That is the thing tendency to eat far beyond than the capacity of the digestion, and there will be burning and distension of the stomach and abdomen with palpitation. Peculiar appetite for coarse food. That line is commonly asked in APGT, other competitive. That is coarse food appetite. Which drug? That is our abis canadensis. Okay, now we go with abnormal appetite. We discuss uneasiness in the stomach. We discuss there is right shoulder blade pain is there, uneasiness is there. There is hungry, canine hungriness is there. Coarse food, prickles, these are the important point. Then female, there is due to this assimilation problem, there will be uterus displacement, that is sore feeling at fundus of the uterus. That is the important thing, relieved by pressure. And in fever, you should always remember that it is more chilly in between two scapula. Between the shoulder, or scapula, there is a chilliness or amon mure is there. Amon mure lack. Another thing is lacne thesis, that is that what is the thing lacnethesis, that is torculency. There is the what torculency is there. Okay, these are all about abis canadensis. It is a small drug, not so proved, but it used, if used mainly weakness of digestion we can use. And one example by this you remember that abis canadensis female, if given vegetable to cut and to cook, then during the cutting period he eat all the vegetable because they have been the coarse food activity, means appetite for craving coarse food. That's why the vegetables are not remaining for all vegetables get finished during the cutting procedure. Okay, now abis nigra. Likewise, abis canadensis, abis nigra also having that chilliness is present. But important line you should always remember that sensation of a lump in the stomach as if hard boiled egg has lost. That is the important line. This, if you don't remember this line, then abis nigra is incomplete, and every question comes from this line. So powerful long acting remedy. These are the mainly used in the old people who having taken tobacco or tea many years ago. If we go that old people, you can remember by this story that old people, they used tobacco and tea many years ago when they having withdrawal, there will be what happen, there will be dull aching pain during day will be happen, wakeful at night, unable to think, that is the thing happen. So that's why what happen, another in stomach there will be also pain happen, pain as if that sensation is important, as if boiled egg had lost in the cardiac in the stomach, then continually distressing failed, total loss of appetite in the morning, greater craving for at noon, at night, having offensive breath and irritation. So that sensation is the important one. Another is in chest, due to this constriction feeling, there will be also chest, there is a constriction feel, as if chest there is at fundus part of the stomach is related to chest part, so also they are having congestion feeling, cough cannot be happen because lungs is not expanded, then dyspnea occurs at the lying of down, then tachycardia, bradycardia, all these things happen. Pain in the small of the rheumatic pain is there. So one thing you should remember in case of dyspepsia after food, that is brownia and your China, calibrom. After food, the dyspepsia, which are the drug? Calibrom, China, calibai, sorry, that one, calibai. Should remember about dyspepsia before food. Calibai, China, pulsatilla, these are the drug which are dyspepsia after food, and before food, that is Nox moscata, dyspepsia before food, Nox moscata and your calicar and your calicar, that one, and your argentina nitricum, because it is an anxious patient. So these are the question can comes from this part. Calicar is dyspepsia after food, dyspepsia after food, that is DAF, dyspepsia after food, dyspepsia before food, DPF. Okay.